Now, rape is a very common type of sexual offense that is occurring in today's society, and we really come across these cases whenever we are performing the medico-legal autopsy reports or even the medico-legal cases in a living person if they are performed. So we generally come across these cases, and we should be knowing how to deal with such cases. If one is basically subjected to writing on a report in such a case, what are the findings that we're going to look upon, and what is basically going to put light on the evidence and basically going to help in the identification of the assailant, that is of mainstay over here. So in this section, basically we'll be dealing with the genital injuries in detail. The genitals are the main traumatized portions whenever a sexual offense is performed. So we have to basically examine the genitals in detail, and if a person claims that he has been victimized with any sort of sexual offense, we are going to basically put some importance on these genitals, and we're going to see if she or even he is suspected to some kind of trauma in such sense or not. So in this section, we'll be dealing with the pubic hair, the vulva, the labia, and the anal examination. It is very important. Although post-mortemly the anal ring or the anal fissure is going to lax, it is not of much significance if time has elapsed, but still we're going to comment upon the anal ring, and if fissures or any kind of trauma is found in such a case. Now, the samples for the biological testing, what kind of samples we are going to take and we're going to send to the chemical pathologist, that we should keep in our mind. For example, the semen analysis is very important, and the interior of the genital organs. So to some extent, we are going to even examine the genitals, the vulva, the vagina, in detail internally, and we are going to comment upon if there is any sort of fresh bleeding, or if there is any sort of fissures or tears found in such a victim or not. The examination, the internal examination, which is of much significance, is within 24 hours. According to the victim, basically he's going to report when the incident took place, and the 24 hours after that incident took place, they are basically the crucial time to which this examination refers to. After that, the examination has less value, but still it has to be performed if important. Now, the genital regions, the vulva and the anus, is inspected externally first of all. So the external examination is dealt in a different section. We are going to examine any anal fissures, any tears, any abrasions, bruises or lacerations of any kind in the anal region has to be documented upon. And then the vulva of the victim is going to be examined in detail. And again, we are going to comment upon any fresh bleeding, any tears, any abrasions, any bruising. If found on the vulva, they have to be documented upon in detail over here. The lacerations, swelling is again very important. For obviously, if there is any sort of trauma, swelling is going to be there. Then we have to be very vigilant to identify any sort of bruising, any sort of fresh bleeding externally and even internally. The discharges are going to be noted, and sometimes the fungal discharges and the bacterial discharges are confused with the seminal stains or the seminal fluid. So that has to be sent to the chemical pathologist for further identification. Any kind of even infections, for example, the gonorrheal infections and the chlamydial infections, if found, they have their own significance because they're actually the sexually transmitted diseases. So they're very important whenever we have a case of sexual offense on our hand. Now, any blood or suspected semen stains anywhere on the body, even it can be on the clothing of the victim, they have to be taken just by scraping the area slightly, and they have to be sent to the chemical pathologist for further sampling. The pubic hair are again very important. This is basically a diagram which is showing the external genitalia of a female, the body of the clitoris, the glands of the clitoris, the urethral orifices are very important, the labia minora, the hymen is the mainstay whenever we are basically commenting upon the sexual act, and we're going to comment upon the intact hymen, the damaged hymen, the non-intact hymen, or even the absence of the hymen is going to be commented upon. Then the anal region is very important. The perineum is very important. The posterior foreshape today, sometimes referred to as the abrasions, the lacerations and tears, and they're of much significance whenever the act is performed on the minors. So the fossa navicularis and the hymen introitus. So hymen introitus is the basically mainstay over here. It is going to confirm whether the sexual act or the is performed or it was not performed over here. Now, examination by the foreign materials, the hair, the vegetation, and the dried seminal stains on the pubic hair are very important, and they are commented upon in detail. The samples of the hair and the combings are taken, and they are sent to the chemical pathologist to find any type of evidence if found. The fine comb with a base of teeth packed with cotton wool to trap any loose fibers. So even the clothing of the assailant can have loose fibers, and it can be found on the hair. And in the combing, it can be sent to the pathologist. Then the vulval labial region is the region we are going to comment upon in detail. And these are all the organs of which can be damaged whenever this act is performed without the consent of the victim. The cervix, the ovary, over here you can see the anal region is very important, the vagina, the vulva, the urethra, bladder, and even the uterus is sometimes damaged. So we have to comment upon all of these. The signs of trauma basically indicate any kind of trauma which is occurring to all of these organs. That will be basically relating to the unnatural sexual offense or the sexual offense which was performed without the consent of the victim. The external signs of any perineal tears are again very important. Perineal tears, as I'll comment upon, it's basically the vulval and the vaginal region, and the anal region even is included in these perineal tears. Now, the laceration of the margin of the vaginal introitus or the anal region is again very important over here. Now, sometimes a complete rip between the two orifices, that is the vaginal orifice and the anal orifice, there is a complete rip between these two. And for example, the minors are really subjected to this trauma. And in those basically minors, we are going to experience this rip that takes place between these two orifices. And we are going to comment upon it. Now, anus, the anal region is again very important. We have to examine this region in detail with caution, interpreting the degree of the dilatation of the anus. The damage to the anus is going to basically cause the extrusion of even the internal organs, and is going to cause fatal injuries to the victim. The post-mortem dilatation is very common in the anal region, so it is of less significance if time has elapsed, because along with time there is anal dilatation even in an innocent case, and so this post-mortem dilatation basically is of little significance whenever we are investigating it, but still we have to comment upon it and we have to document it. Unless the dilatation is very marked and is very obvious, and we are suspecting any cases of buggery or sodomy, then we are going to comment upon this anal dilatation. Now, the samples for the forensic biological testing, they are again very important. What samples we are going to send to the chemical pathologist, we have to keep that in our mind. Now, the samples that are taken are the interior of the vulva, labia, and the vaginal orifice. So they are even sent with swabs. They can be the wet swabs and they can be the dry swabs over here. The wet swabs are basically with the alcohol, and the margins and the interior of the anus is again very important, and they are going to be swabbed and sent to the chemical pathologist again just for the identification of the assailant or the identification of the suspect. Now, the mid-vagina is again very important, and basically we can find any kind of seminal fluid over here, and which can basically get our hands on the DNA of the assailant. So it is again very important, and we have to send it for the swabbing. Using a speculum or a broad handle of a dissecting forceps to part the lower vaginal walls gently to allow the swab to reach the area without contamination with the lower vagina, because the lower vagina is sometimes going to carry the vaginal fluids itself. So we are not going to contaminate it with the lower vaginal fluids, and we are going to carefully send this swab to the chemical pathologist. The upper vagina is again, it has its own significance. Again, we can find any sort of seminal fluid and seminal staining, the cervix, and even the posterior fornix is to be suspected and inspected in detail over here. How are we going to do it? We are going to use a spatulate instrument if more fluid contents are seen, and it should be recovered by a pipette, and the pipette is going to be emptied into a careful jar or in a test tube and then sent to the chemical pathologist. The interior of the genital organs are again very important. The swabbing is done, the chemical fluid sampling is done and has been sent to the examiner. We are just going to comment upon or document upon the interior of the genital organs by using a speculum. They're examined again for any kind of trauma. Now, the trauma can be the lacerations, the abrasions, the bruising, any sort of fresh bleeding around the furnaces, around the hymenal regions are again very important. The presence and the condition of hymen is again very important and is going to comment upon whether the hymen is present, whether it is intact, or whether it is in a damaged condition. The fistula between the vagina and the rectum or even the peritoneal cavity, it is going to be basically commenting upon if there is any fistula, if there is any fissure, if there are any tears, and even the tears are of different degrees. They can be of a first, second, or a third degree. So we are going to comment upon what degree of tears is present, and especially it happens in cases of the minors. The extrusion of the intestine. So the anal dilatation, sometimes there is an extrusion of the intestine. And again, basically the dilatation of the anal region is even seen in normal innocent cases. So it is of less significance. But if this dilatation is much larger and the extrusion of the intestine has taken place, that basically provides an evidence that the sexual act was performed or the sexual offense was performed. So in this section, basically, we dealt with how are we going to examine the genitals in cases of the deaths associated with sexual offenses. That was the end of this section. Thank you for watching sqadia.com.